Here at Baptist Healthcare, we have real legends among our team. We have ordinary people who inspire us with extraordinary actions of ownership, integrity, compassion, excellence, and service. On March 4th, 2020, we cared for our first COVID-19 positive patient. More than 130 team members had encountered that patient. Little was known about the virus at that time, and CDC guidance on treating team member exposures was evolving. We needed to act quickly and use available resources to protect our team members and patients. On this day, Nova Francis was asked to lead the charge in swabbing our team members and providing guidance to them regarding exposure risk and quarantine practices. Nova didn't hesitate to serve our team members and organization, despite the potential risk to her own health and safety. Nova continued to work in this capacity for months, aligning closely with team member health to create a clinic for exposures. Operationally, she created practices and processes with the lab and other departments to ensure a smooth experience for the team members involved. Her operational efforts, though, pale in comparison to the unceasing kindness and care she showed team members during this difficult time. She worked around the clock, evenings, weekends, to swab our team members because it was important to her to make sure they had the answers they needed. She spent time with each person, listening and providing follow-up calls. She even made a house call to a team member who was too weak to visit in person for testing. Team Member Health's office received many calls from those who expressed deep appreciation for Nova's heart of gold as she lives our values of ownership, compassion, and service. Her passion for her work and caring for others caused her, at times, to be moved to tears while speaking about our team members. Her peers describe her as an incredible woman who continues to be a valuable resource to lean on when needed. Although she is no longer coordinating the Team Member Health Clinic, she does continue to support that department. Because she generously shares her training, knowledge, and kindness, Nova is a Baptist healthcare legend. The impacts of Hurricane Sally affected our organization and our people in numerous ways, including subsequent damage to main traffic routes. Imagine caring for patients with critical needs for 12 hours, patients suffering with COVID-19, respiratory issues, heart irregularity, diabetic crisis, strokes, and so much more. Then, after a long shift, when you are ready to rest, your drive home may take up to 2 hours. Team members could no longer travel the Pensacola Bay Bridge to and from Gulf Breeze. Hurricane-force winds and seas caused huge construction barges to break free of moorings and strike the bridge. The damage took the bridge out of commission for about 8 months. Michelle Koval, a critical care nurse in Gulf Breeze Hospital's intensive care unit, listened to fellow night shift nurses explain how hours were added to their daily commute, and she decided to act. Michelle is fortunate to live a few minutes from her hospital location, and she wanted to do something to help her fellow teammates who repeatedly made the tedious commute. She offered a bedroom to coworkers making that long trip to and from Gulf Breeze. She and her husband had the available room since her grown sons now live on their own in other states. Michelle used this space in her home and in her heart to take a burden off of these tired ICU caregivers. She worked out a plan with 2 different team members to let them sleep and eat at her home while working out their weekly shifts. The team members took Michelle up on her offer, and they were able to relax and unwind without having to spend the extra time on the road. Michelle welcomed one of the new house guests to bring her dog and make extra arrangements so it could be kept separate from her own pet. That same individual needed gas after the storm when fuel was so hard to find. True to form, Michelle shared what she had. Michelle felt she did nothing extraordinary and was just doing what she could to help. She wished more team members would have taken her offer to stay. Her values of integrity, compassion, and service are evident in how she cares for her work family patients, and everyone she meets. Because she steps up to help and problem solve, Michelle is a Baptist healthcare legend. Don Carter, a technician in Baptist Hospital's ER, needed cataract surgery, and his vision had become too poor to drive safely at night. Since he worked the night shift on weekends, his situation was a challenge. Don and his wife would load up their 4 children near bedtime so his wife could drive him to work. Then she would have to wake the kids up in the morning to pick Don up when his shift ended. When Patty McCall found out what the Carter family was doing, she offered to drive Don to and from work. On every occasion when the two were on shift together, Patty would drive out of her way to pick up and take Don home. She continued this until Don had his cataract surgery. Patty would often stop by the store to purchase treats for Don's kids. Don would protest, but Patty just responded by buying more goodies the next time. She would stay to chat with Don's wife and children. They came to adore Patty and looked forward to times when she'd stay to visit with them. Patty saw a need and acted on it. Her selfless and kind actions blessed this family. They will never forget the comfort and friendship she brought them and the burden that she eased. Don said he has been a witness to Patty's many acts of kindness toward patients and other team members over the years. Now, he experienced it on a much more personal level, and he wishes to acknowledge her extraordinary compassion. If you ask Patty, she will tell you she was simply doing what she could to help. If you ask the Carter family, you will know that Patty's actions blessed them beyond measure. Patty lives the values of ownership, compassion, and service, and that's why she is a Baptist healthcare legend. Driving down Highway 87 near Navarre in November of 2021, Mary Daren noticed something burning along the side of the road. At first, she didn't give it much thought. All that changed quickly when she realized it was a car on fire. Her first thought was that she needed to report the fire, so she grabbed her phone and dialed 911. At the same time, she realized that no one was stopping to assist. Mary didn't hesitate to pull over and make her way toward the burning car. She immediately realized a woman was still in the driver's seat. Flames had engulfed the car's front end, driver's side, and underside. As Mary determined what to do next, another driver pulled over to help. He happened to be a student paramedic. Together, they solved for the quickest, safest way to extract the driver. To add to the struggle of the situation, the driver's seatbelt would not unbuckle. A third passerby stopped to help. A box cutter was found and used to cut the seatbelt loose. Together, they pulled the victim from the burning car. Mary's work wasn't over, though. With the car now completely engulfed, the driver had to be moved further away from the scene. Mary directed the others to move their cars to a safer distance. She realized the driver was badly burned down the entire length of her left leg. Mary gave instructions to bystanders to gather first aid supplies since neither police nor fire and rescue were yet on the scene. As she gave first aid to the driver, she realized the injured woman was going into shock. Once first responders arrived, Mary picked up the woman's personal belongings. The driver's phone was ringing, so Mary answered. The caller, a family member, listened as Mary explained the situation. The family was shocked by what had occurred and also so very grateful for the kindness of strangers who stopped to help. Mary was the first responder at the scene. Without her quick action to offer aid, the driver may have perished. Mary was very fortunate that she escaped with only singed hair. She is a selfless and courageous individual who lives the values of ownership, integrity, compassion, and service. Mary is also a Baptist healthcare legend. Pandemic effects go beyond the health of our community and patients at Baptist. The world has been affected by supply chain issues and shortages of essential items. Team members in the Baptist Hospital Behavioral Health Unit experienced a drop in work hours due to fewer patients receiving inpatient care during the height of COVID-19. They also had difficulty finding needed food and cleaning supplies. Anita Diane Thompson and Gigi LaLiberty saw the need and partnered with Brownsville Assembly of God's food ministry to obtain donated bottled water and foods. Canned goods, cereal, bread, and other supplies greatly helped these team members who were struggling to find them. Some team members began checking in with Diane and Gigi for specific needs. The duo's efforts began with word of mouth and quickly grew beyond the walls at Baptist. The need increased further after Hurricane Sally hit in September 2020. Diane recruited more volunteer help for pickup and delivery support. After filling up her own minivan, Diane arranged for a truck to drop off perishable, refrigerated, and frozen foods. Team members could take items such as fruit, milk, and lunch meat home to their families. Gigi helped Diane with distribution, especially the loading and unloading of supplies. Gigi also helped store the package supplies, and she made multiple trips to meet staff who were not working or able to pick up donations during Diane's scheduled pickup times. Diane and Gigi are called to serve others and have big hearts for their patients and work family. They stepped up to help those faced with life difficulties during the pandemic and after hurricane devastation, and they are still helping out today. Diane and Gigi go out of their way to live the values of ownership, compassion, and service. They embody our mission of helping people throughout life's journey, and they are Baptist healthcare legends. Vicki Leyva, longtime unit coordinator on Behavioral Health's youth unit, experienced apartment flooding due to Hurricane Sally. Vicki was staying in a complex that needed repairs. She needed to leave, but she could not physically move or pack her belongings. That's when her work family stepped up to help. Vicki's supervisor, Rachel Griffin, asked for assistance from others to move Vicki into a safe, comfortable environment. Word quickly spread about Vicki's situation, and nearly a dozen team members and some of their family members and former Baptist team members volunteered to aid Vicki. Chad Havens, J.P. Jones, Jennifer Fultman, Mary Hawkins, Natalie Byers, Andy Barrett, and Rachel took time on a weekend to rent a truck, pack up Vicki's belongings, and move them into temporary storage. This occurred immediately after the storm, when some of these team members were dealing with their own post-hurricane cleanup and damage. This team recognized that Vicki needed their help immediately. Vicki lives alone and is in her 70s. Such a demanding physical effort was not feasible for her to do without help. But Vicki is special to the team since she has worked at the Baptist Hospital Behavioral Health Unit for more than 20 years. Her team knows and loves her. They put their own time and needs aside to haul everything Vicki owned. The Baptist Warehouse and Jennifer donated boxes to help with moving the items. Manager Ingrid Witcher stayed behind to oversee the work responsibilities so some of the team members could volunteer. Several months later, with the repairs made, Vicki was able to move back into her apartment. Mary and her husband helped Vicki transition her belongings home. The Foundation Helping Hands program helped Vicki cover utility costs after the storm. Each person ensured Vicki was cared for and secure. While the hurricane impacted so many, these team members went above and beyond to donate their time and pool resources to assist Vicki. They said that they did the right thing, help a fellow member of their team. These individuals exemplified the values of ownership, integrity, compassion, and service, making everyone in this group Baptist healthcare legends. At Baptist, we have a commitment to excellence that sets us apart. Our legends inspire us to give our best to meet our mission of helping people throughout life's journey.